Breast cancer is one of the most serious and common forms of cancer. I wanted to talk today a little bit about it and bring some awareness around it as well. Breast cancer is very serious. If your life has been affected by it, you know what I'm talking about. I have several patients over the years who have had breast cancer. I currently have 2 patients with breast cancer. It's serious. It's very much treatable, however. A lot of the times we can prevent death and injury by detecting this and screening for it and figuring it out early rather than late. There's no such thing as a good diagnosis of cancer of any kind, but with regard to breast cancer, it's highly treatable. The sooner we can detect and treat the breast cancer or any type of cancer, the better. As such, we have a task force in America that is designed to check out our guidelines. What are we doing to screen for various things and determine if we're helping people or hindering people. They changed the guidelines on pap smears, for instance, because we were over screening people, and so they shifted that around and we're able to change those guidelines just a few years back. With regard to breast cancer, the United States Preventative Services Task Force, that's the task force that most family physicians look to for guidelines and guidance on when and how often we should be screening people for different things. The United States Preventative Services Task Force, their guideline on breast cancer screening is starting at the age of 50 and screening every 2 years. That's with people with no family history. If you have any risk factors or family history of it, then it's starting at age 40 and every 1 year. If you have had a family history, an immediate family relative with breast cancer, the guideline is to screen 10 years prior to the onset of breast cancer in that individual. For instance, if I were a female and my mother had breast cancer at age 45, I would want to be starting screening at age 35. How is screening done? There's a bunch of ways to screen for breast cancer, but the mainstay that we do right now is through mammography. With certain high risk individuals, we might check some genes for those people. We may even do breast MRIs, which are very, very accurate. But in the majority of people, a simple mammogram is plenty for breast cancer screening. What about self-breast exams? The United States Preventative Services Task Force has looked at self-breast exams and actually recommended against doing them. People were finding things that were actually not worrisome, and it was predisposing them to more doctor visits and more things. And so we try not to do self-breast exams. Professional breast exams by your doctor annually is totally reasonable, but otherwise the mammography is plenty. What about thermography? There's some other ways of screening for breast cancer. Thermography is actually interesting, and the guidelines on that is not to use it right now. The United States Preventative Services Task Force recommends against it. The evidence behind using that is lacking, and there's a lot of false positives. So if the thermography shows that you definitely have a hot spot in your breast, then you have to go through a mammogram and an ultrasound and maybe an MRI to further investigate that. So right now, the United States Preventative Services Task Force is recommending against that. As such, most family doctors recommend against that as well. Same thing with OBGYN, same thing with most other physicians. Hey guys, hope this video was helpful. I would definitely talk to your doctor about what guideline is sufficient for you. It depends on what your risk factors are, family members. There are a couple other variables. Use your family physician to kind of help navigate to what kind of guidelines are appropriate for you. Don't forget to like and subscribe to our channels. Voyage Direct Primary Care is a subscription family medicine service. It's beautiful healthcare. We talk about all these things in our clinic all the time with our people, and we'd love to have you check it out on voyagedpc.com.